Hello, my name is Annalie Martin, and today I'm going to be going over checking placement of gastric tubes, large bore tubes, small bore flexible feeding tubes, and gastrostomy, and I can't say that word, the gastrostomy tube, which is the same as the PEG. I see why they just call it the PEG tube. So caring for the gastrostomy tube, the PEG tube, that can never be delegated, and it is usually in the post-operative period you wouldn't, but on all the other, everything else that I seem to be reading in the book states that you wouldn't delegate that at all. If I'm wrong, just let me know. But so you're gonna need like your gloves, your cleanser, and some gauze. You're gonna want to assess the or note any drainage, skin breakdown, erythema. So you want to measure the exposed length of the tube, and you're going to compare that with the initial measurement. You want to make sure that it's stabilized, that it's not like dislodged. Look for any tension, because if there isn't enough tension, the tube may leak. You always want to make sure that they have their pain medication if that is ordered, because sometimes if it's just placed, they may have pain. So for the first 10 days, you are going to want to dip the cotton applicator into normal saline and gently clean around the site. Avoid adjusting or lifting the disc for the first few days. Just clean it, and then after 10 days you can clean under this. And once the sutures are removed, you can push the tube forward, and you can rotate it 90 degrees. And you want to do that at least once per day. As always, assess for I can't talk today, abnormalities, and you want to document the care. So if whatever you used, the assessment site, the measurement, the drainage, and of course you want to write down the amount and the color in that case, the meds administered, and the patient's reaction. And I did also read with that that when you're checking for placement, sometimes you will want to try to do the x-ray. That's the most accurate way to check the placement. Otherwise it may just you may have to check the contents, the pH, to figure out whether it's in the right spot. So there is one thing called a small bore NG tube that's inserted through the nose, and it sits in the stomach. That is going to be a small diameter, and that is for feeding only. There's no suction on that. There's 2 ports on that available in case you want to administer the medication during the feeding, and you want to always flush that before and after, usually with about 30 mLs of water. So the large bore NG tube is also referred to as the Salem sump. That can be used for suctioning. That's the difference. Sometimes that may be used they may suction if there's a bowel obstruction. So with that one, you'll want to usually set it to low intermittent suction, and attempt to suck out whatever is causing that bowel obstruction. So that type has 2 lumens. So the primary may be for suctioning, and the secondary, which is usually blue, will be like a vent. And you never want to give feedings or medications. They shouldn't be hooked up to suction. Only the primary. So if the seal on the vent is not working, the gastric juices may leak out, and that can make a big mess and be very uncomfortable for you and the patient. So they just have a larger diameter, and they're more rigid. So you would really want to assess for skin breakdown if you're using one of those. I mean, of course, you're always going to want to assess for skin breakdown, but being that it's larger, there may be a bigger chance of skin breakdown. So then the PEG tube, that's shorter because it goes right into the stomach. So it doesn't have to go in through the nose. So since it just goes right through the stomach, it is shorter. Sometimes I was doing some research on them. Some of them have a balloon, some of them don't. And then that will be inflated on one end. so that it like won't become dislodged. So with the PEG tubes, they are more long-term. So you're going to want to look for the drainage and the skin breakdown at the insertion site, and just like all the other ones, they do have 2 ports where you can administer the medication. All right, thank you.